Hi, we are here with Dr. Frances Verter, founder and director of the Parents Guide Cord Blood Foundation. We are at the Cord Blood Connect, our international congress on cord blood. So, Dr. Verter, what do you think have been the biggest highlights of these 3 days of Congress?
I think the biggest highlight is that members of the cord blood community are trying to form a new network to go out and educate more hematologists and oncologists on the uses of cord blood uh, so that the doctors are aware of it. There are only a limited number of transplant centers that have expertise in cord blood, and they have created an educational program that they want to take doctor to doctor to explain the pros and cons of cord blood transplants and the diseases where they work very well and offer better long-term outcomes for the patients.
How do you think Cord Blood Connect can improve the topics discussed at this congress to enhance learning for future events?
Cord Blood Connect needs to have an entire session talking about research on cerebral palsy and other neurological conditions such as autism, hypoxic ischemic encephalopathy, etc. But in the past, in previous years, they used to have an entire session on neurologic disorders treated with regenerative medicine using cord blood. This year, they did not have a session. Um, Duke University is in between on trials in this area, but just because Duke did not want to make a presentation is not a reason not to have a session. They should have filled the session with researchers from other countries. Part of why it is so important, actually the main reason it is so important to have presentations about conditions like cerebral palsy and autism is that they are much, much more prevalent than the transplants that everybody is talking about at this conference. I mean, with cerebral palsy in the US, it is 1 in 345 children. With autism in the US, it is 1 in 44 children. So if they would address these topics, family bankers would be much more excited about attending this conference because they have parents who want treatment for these conditions. And that would be good for the conference and good for the public. It would be good for everyone.
Thank you so much, Frances, for sharing your insight with us today. It's been a pleasure having you on our interview. We look forward to seeing the continued advancements in cord blood research and the impact it will have on future generations.